So, if you've got tight forearms, if you've got tennis elbow or golfer's elbow, sore wrists or sore fingers, one of the first things that they want you to do is obviously improve pain-free range of motion. So making sure you're able to do this, get the blood flowing and feeling good, but then you might want to do some stretching. There's a couple of classic and easy stretches that you can do. First one, let's imagine that you are in a bit of pain and it's not really good. You can just start by not using the fingers but just on the palm. You're looking to improve pain-free range of motion and then build that up over time. So that is going to stretch all the way through here, coming down through there, but it's not going to put as much pressure as if you add your fingers. So do that, 30 to 90 seconds, hold, have a little bit of a break, come back. Once again, if you can do up to 5 minutes a week, preferably a little bit more at different times, you should start to see some changes and some improvements. Once that's feeling good, then you're going to add your fingers in, and you can see how that's already starting to add more of a load through there. I've still got my elbow bent. Once again, you're going to a level that you're comfortable, but then once you feel good with that, opening that up all the way, and that's getting a nice stretch. I can feel that stretch all the way from my fingers, through my hand, up into my bicep, really opening that up. Hold it, and you want to hold 30 to 90 seconds, feel it release. Have a big breath in, add a little bit of resistance, and then on the out breath, release, and you should be able to go even further. So that's the first one. That's going to take care of all those muscles through there. Obviously, if you've got any, the wrist is a really complicated joint, which is really cool. So in order to move, even if it's like that, these ones have to work as well. So even if your pain's here or your tension's here, you need to make sure you release these ones too. So it's pretty much the exact opposite. So you just start, I'm not moving my hands, start like that, holding. When I feel comfortable with that, I'm going to go to the fingers as well. So I'm pulling that through like that, and holding. And then, just like we did with the last one, I'm going to see if I can get that stretch all the way through. So in this one, obviously I need to kind of flex my tricep a little bit to make that joint kind of stay still. And I'm going to bring that up nice and simply like that. And that feels actually really nice. So what we've done so far, we've done the flexors, we've done the extensors, but we've still got the muscles that allow this to move like that. So once again, we're not hurting ourselves, but we're going to hold and then open that up through there. You might find that you get a different part of the muscle holding it like that, holding it like that, holding it like this. So just find where you feel that nice stretch and then hold for 30 to 90 seconds. Do that at least 5 minutes a week and you should still feel that start to improve. And then we've got the opposite. So same idea. I'm just going to hold my own wrist, going to pull that through like that. I might feel more of a stretch like this, or I might feel more of a stretch like this. Perfect. 30 to 90 seconds, giving yourself a little bit of a break, coming back and breathing, should be able to go further. If you're trying to also get some of those flexors and extensors, you can do that yourself, or I can move my hand like that as well. But typically, we've taken care of those ones like this and like this, so we're aiming more for through here and through here. Once you've done that, then you can move on to some strengthening. So, if you do have tennis elbow, or golfer's elbow for that matter, or forearm pain, or your fingers get sore, the first thing that they'll get you to do is, if you can, just hang your hand over and just nice and slowly, and then moving from side to side like this. So that's taking care of the extensors, flexors, supinators and pronators. Starting with no weight, so you're really reducing the chance of kind of hurting yourself. It's not just about how you feel at the time that you're doing it, but how you feel the next day. It's okay to feel a little bit muscle sore, like you've worked something out, but you don't want to feel like you've gone too hard and like, you set yourself back a few days. So do half as much as you think you should, or you can, and then wait to see how you feel over the next couple of days and then slowly step it up. But let's say that you're feeling good, you want to kind of improve or increase your strength, and you're just holding a water bottle. Works really well. You'd be surprised how quickly that can fatigue. That's working the flexors and then obviously the extensors. And then for the hammer, so the supinator and the pronator, if you want to be nice and easy, hold it in the middle, but then as you get more advanced, hold it on the end. And that's you're going to really feel that through. So nice and slowly, do 10 to 15 3 times a day if you can, and you should feel that strength start to build up. If you do have tennis elbow or golfer's elbow, you get like your wrists get sore and tired by the end of the day. After a couple of weeks of doing that, you should feel stronger with this, and then once you feel stronger with that, you should hopefully start to feel a reduction in your pain. Sometimes the pain reduces first, but typically you want to feel stronger first. So once you've improved your pain-free range of motion, and you're looking to start to reload the tissue, particularly if you're a golfer's elbow or tennis elbow, you want to do isometric holds. So the easiest thing to do is you just hold your wrist and you're using your own hand to push. That forces those muscles to tense through there, start to wring out some of the inflammation, allow that to get stronger. Once you're really confident with that, holding to 30 to 90 seconds, then you can move to the fingers. And that's going to make it even harder and use more of the muscle. And then obviously, you want to make sure you do both sides. And once you can do that better and stronger and you're feeling pain-free, that's when you're ready to move to some of those kind of more weighted exercises. But just start nice and simply. We'll show you those weighted exercises in a tick. In Chinese medicine, the body's interconnected, so we can use one part of the body to massage, like to help release another part. So if you do have golfer's elbow or tennis elbow, the classic Chinese medicine points that they can use to help them feel better. And the good thing about this is you can massage these and you should feel better as you're doing it, help release some pain, is if you've got your knee just below that, 4 fingers below, you'll find a nice meaty bit through there. So you're going to get in there, you're going to find that sore bit and you're going to massage that. As this starts to relieve, it should tell your muscles in your forearm to start to relax, get some better blood flow through there and release the pain. The next one is above the knee, and right on like your ITB band, that kind of like bandy bit. If you come along that, around about a hand breadth up, once again you're going to find a nice tender spot. So if you get in there and you massage that yourself, you should start to feel some relief in your wrist and in your forearm and on your elbow. Traditionally, we say start with the opposite side and then move to the side, the same side that's affected. But everyone's different, so just figure out what works best for you. Once you've done that, then you might be in a position where you want to massage your forearm. So if this is the sore bit, I would suggest starting and then moving from that. If your wrist is sore, starting from there. The reason for that is as these muscles release, you'll get more blood flow through there, it will reduce your pain and you'll feel better. So if it's tennis elbow, the main culprits are these muscles that kind of wiggle your fingers. So to find them, all you need to do is start from in between those bones and you can just massage your way up. You're going to find, particularly as you start getting closer, feel how see how that kind of flicks over, those tight bands. Find the tight band, put some pressure on it, hold it to 30 to 90 seconds. That should start to release. As that muscle releases through there, particularly if you do have tennis elbow, you should start to feel better through there as well. And then coming up, being gentle, but just massaging through that spot itself will help increase some blood flow, hopefully reduce some of the inflammation. Obviously, if you're doing this side, you can't neglect this side. So it's the exact opposite. Let's say we'll assume it's the elbow, we'll start from this end, but if it's the wrist, start from this end, move that way. And you can't miss it if you go in between the bones, and then see if you can come all the way down onto that elbow. Now, if this is really tight, generally there's going to be some really tight bands in this section. So you might want to do a few passes, and when you wiggle your hands, you can see where the muscles are. Oh yeah, that's the tight bit there. Find the really tight spot, hold it for 30 to 90 seconds, you should feel that improve, and then making sure you haven't missed any. So get that nice and released, that'll increase the blood flow through there before you start getting into that side, through there like that. So if you've hurt your wrist or your hands kind of sore, the easiest and best place to start, even if you've got golfer's elbow or tennis elbow, is you can just open and close the hand. You can do this really slowly and easily. Yeah, so you want to always do pain-free range of motion, so you don't need to, as you get stronger, you can add a little bit more tension. It's not just about how you're feeling it at the time, it's about how you feel after. So don't go too crazy. You want to feel good while you're doing it, and making sure you don't go so hard that it kind of like you feel like you go backwards a few days. Once that has started to improve, then you can add some kind of resistance that you can kind of play with. If you've got some putty, that'll be great, but I don't know about you, but I don't have any putty lying around. So you can just start with a towel, and just practice gripping and then using all of the different fingers to start to get that to work. If that's too hard for you, then start by making sure you can touch your thumb. Once that's getting better and stronger and you got your dexterity back, gripping again, seeing if you can use your individual fingers, thumb, all of them at once, and then working your way up. That's going to help all the muscles through there, help start to restore some strength, hopefully start getting you feeling a lot better. So if you've got some finger pain or some joint pain, or your hands aren't quite as strong as you'd like, particularly around your thumb or your fingers like you've jarred them, Chinese medicine has some great massage techniques that you can do away from the side of pain that can help increase some blood flow and hopefully reduce some of your pain. Obviously, if this hand's really sore, try and massage the other one, but sometimes if this is sore, you can't quite get it. So you might need to ask a friend to help, but you can normally do these yourself in some kind of way, but just be nice and gentle with yourself. The easiest one that you can kind of get to is a point along the bone on the outside through here. This point's called Wu Hu, which means like 5 tigers. But essentially, in Chinese medicine, we say that these points that are coming along through here will actually help reduce pain, help improve like strength through the fingers and the hand. So you just simply start along that bone, and you're just going to find and massage through there. You should find a nice little nodule. It's a little bit tender, particularly if it's a bit sore, and just hold that and massage that for a little bit. Now, if this hand is sore and you can't use your own hand to do that, that's going to make it a little tough. But luckily, we've got a few ways around that. So you can just hold your thumb like that, and then you've got a nice little meaty bit or bony bit there. You can line that up yourself, and you can just massage that through there. Find the sore spot on that, hold it, and then gently move your hand, and as you feel this part on your thumb feel better, you should start to feel the muscles release or the joints release. And then you just move slowly to the next bit and then the next bit. Anytime you find like a little bit of a sore bit, hold it for 30 to 90 seconds. And as that releases on your thumb through there and there, you should start to feel that feel better. If you can't do that, you can try your elbow or ask a friend.